Hi everyone, my name is Dr. Nicole Cozean. I am a pelvic health physical therapist, and I am here today to talk to you about how the pelvic floor and interstitial cystitis are really connected. Now, a lot of people might be thinking like, why is a physical therapist talking to us here and not a physician or a nutritionist or a dietitian? And the reality is, you guys, is that 90% of people with interstitial cystitis also have been shown to have pelvic floor dysfunction that is significantly contributing to all of your IC symptoms. So we're going to go over today what is the pelvic floor, why it can be causing some of the IC symptoms, how we can treat it, and how you can find a pelvic floor physical therapist near you to help with these symptoms. Now, I've been an Interstitial Cystitis Association board member for over 5 years. I have a clinic in South Orange County that has 6 other pelvic floor physical therapists, all super dedicated to working with the pelvic floor and working with patients that have either chronic pelvic pain, endometriosis, or interstitial cystitis, in addition to postpartum concerns as well. I have written the book, The Interstitial Cystitis Solution, and I also have an online course for interstitial cystitis called the IC Roadmap. Now, like I said previously, a lot of people are confused. Do I have pelvic floor dysfunction, or do I have interstitial cystitis, or do I have both? And we're not necessarily going to answer that huge question in 10 minutes here of this video. But what I want you to all understand is that the pelvic floor muscles can be so connected to and causing some of your interstitial cystitis symptoms that a pelvic floor physical therapist can be a great addition to your medical team. Now, what we know about interstitial cystitis from the most recent research is that it is not just a bladder condition. You have bladder symptoms, but it's not necessarily the bladder that is the cause of those symptoms. And I know many of you guys are like, what? Mind blown? That's not what I thought. And that's not what a lot of people used to think either. But with the most recent research, what we know to be true is that interstitial cystitis, or bladder pain syndrome, or painful bladder syndrome, is a pelvic floor dysfunction problem. It's a upregulation of the nervous system problem, meaning that the way that your bladder, your brain, and your pelvic floor are all talking to each other has been disrupted. And you are no longer getting super accurate information about when your bladder is actually full. And in some cases, the signal that is being sent up to your brain from your bladder is that, ouch, I hurt. I hurt with filling. I feel like there's glass shards in there. I feel like I have a UTI times 1,000. And your brain is interpreting that as like, oh, are you serious, bladder? Really? And then sends a message down to your pelvic floor to tighten. And your bladder is like, oh, is that helping? But guess what? In 90% of you, there's not something actually wrong with the lining of your bladder. And that's what makes interstitial cystitis so frustrating, is that a lot of medical practitioners are all focused on bladder-centered treatment for what is seemingly a bladder problem. But that's not the whole story. And the rest of the story for a lot of you folks out there that are suffering with IC is the pelvic floor. Now, everything that I'm about to say is regardless whether you have had diagnosis of IC with Hunner's lesions or diagnosis of IC without Hunner's lesions. And who can help you to figure that out is your urologist, which is good to go to them to make sure that there's nothing else going on. You don't have an infection, and that you don't have actual ulcerations to the bladder lining. Everything that I'm going to say is for every single person that's diagnosed with IC, no matter if you have Hunner's lesions or not. Hunner's lesions actually have a different track for the medical treatment that your urologist is going to help to provide for you. but pelvic floor physical therapy can be great addition to your medical treatment for if you have Hunner's lesions or for the majority of you that do not. So what is the pelvic floor? The pelvic floor is a series of muscles, and this happens to be a female pelvis, but males, we have actually very similar anatomy. It's just the area right here is just a little different. So this is the pelvic floor. Anything that you see in red here goes from pubic bone all the way to the tailbone, and it also goes from the sit bone to the sit bone. Now, if you're taking a deep dive into, like looking down into the pelvis, you can see all the organs here. The organs are the bladder. If you have a uterus, then the uterus sits here, and then the rectum sits back here. Now, as you can see, all of these organs are really close together, and they can talk to each other if each of them are having a problem. So if the bladder is irritated, it can talk to your uterus and cause uterine cramping, period pain, all kinds of other things. If your uterus is irritated, say if you have endometriosis or suspect that you do, even though endometriosis is technically outside of the uterus, sometimes you have a lot of period cramping that's going along with this area that can talk to the bladder and cause urgency frequency of urination. And also if you, this rectum back here, if you have constipation, then that can be full back here and just basically sort of talking to the uterus if it's there, or the bladder that says like, hey, sending some signals. And then the bladder doesn't know anything else to do except for, hey, I have to pee or I'm in pain. And then guess what happens, you guys? The bladder, now I'm going to take all those organs out, and the bladder is just going to sit right where it is. If you take a look deep into this pelvis, anything that you see here in red are also muscles. This is your pelvic floor muscles. It's not just a clever name. This is actually the floor of your pelvis. And one of its jobs is to literally support the organs. So if the pelvic floor doesn't exist, some of your organs would be like, whoop, right out the bottom here. Hopefully that's not happening to you all. Instead, it provides a nice hammock, a nice trampoline, sometimes we call it, for the organs here. It also has a couple of other functions. That's just one of them. We'll get to that here in a second. So the bladder sits right here at the front of your pubic bone. That is why it's very close proximity to this area. And one of the biggest hallmark signs of IC is pelvic pain. And a lot of people will have pelvic pain right above the pubic bone because that's right near where the bladder is. Now, the interesting piece about this little bladder here is that, as you can see here, it sits right on top of some of these pelvic floor muscles. So if this bladder is irritated for any reason, either your brain is sending it messages that it has to pee, but you really don't have to go. If it's getting irritated by either the uterus or the constipation from the rectum, if these pelvic floor muscles are working extra hard to do something, that can send a message up to your bladder that says, hey, either I hurt or I have to pee. That message goes up to your brain. Your brain is like, what should we do? We should send her a message that she has to pee. And then that message goes down to that area. Now, sometimes your bladder is actually full and you go quite a bit. Sometimes it's not. And then we have the cycle perpetuating where you're going. I'm sure you guys have all been in this situation where you feel like you have to go so bad. It actually might be a little bit painful to go. It's relieved for a second and you go like 2 or 3 seconds of pee, maybe 5 seconds. Yikes. That meant that your bladder got an incorrect message of that it was actually full when it's not. Now, most people that have a full bladder actually pee 10 seconds or more. And that might be all of you people with interstitial cystitis might be like, oh my gosh, if I could pee like that, that would be the end of my problems, right? But here's the deal. So there's a lot of different things that can irritate this bladder. And it's not just about the bladder lining like we talked about before. More often than not, and I am telling you this from research, more often than not, it can be the pelvic floor muscles that are actually creating some of those symptoms of interstitial cystitis: the urinary urgency, the painful urination, the urinary frequency, the difficulty emptying your bladder, the feeling of incomplete emptying. So you actually do go, and then 2 minutes later, you feel like you have to go right again. All of those things can also be signs and symptoms of a pelvic floor that is a little too overactive, a little too much tension in it. And so one of the actions of the pelvic floor, like we talked about, was supportive to the organs. One of them is sphincteric, meaning that your pelvic floor has to relax to allow the urethra to open, to allow pee out. And it also has to close back up to make sure that pee doesn't come out when we don't want it to. That goes for any gender. So the pelvic floor has a supportive function, a sphincteric function, a sexual function. The pelvic floor has to relax to allow something to be inserted. It is involved because this yellow thing right here is the clitoral area. It also has to contract to have an orgasm. That's true for men and women. It helps males keep an erection. So if you have some dysfunction in this region, then you can also have sexual dysfunction and or sexual pain. And then the fourth function of the pelvic floor is also stability. And this is where it gets really interesting and why physical therapists are such good additions to your team. Every single one of your pelvic floor muscles, remember the ones that can talk to the bladder, actually attach here at the tailbone. The tailbone is the end of your spine. This triangle bone right here is called your sacrum. This is your SI joint or sacroiliac joint. And then right above that is all of your lumbar spine, or basically your back. So because every single one of your pelvic floor muscles attaches to that tailbone, it is greatly involved in the stability of your pelvic floor and your pelvis. And in fact, your pelvic floor is actually considered one of your major core muscles. So if you have back pain, if you have hip pain, you might think those things are unrelated to your interstitial cystitis, but I'm here to tell you that they can be extremely related. And making things even more complicated, this muscle right here, this guy right here, this broad one right there, this is all called your pelvic floor or your levator ani. This one on the side is actually a hip muscle. And that is just how intricate the pelvic floor is with some of the hip musculature. If you've heard of anything called your piriformis, this muscle right here called your obturator internus is a close cousin to your piriformis. And basically your hip muscles, your back muscles, your abdominal muscles, your deep core muscles are all supposed to be activating when you are lifting, pushing, pulling, doing a bunch of stuff. If they're not, and if you have a weaker core system, either from a previous back surgery, a C-section, any abdominal surgery, any other gynecological surgery, or hip issue, your core can become a little bit weaker. Guess what comes to the rescue? Your pelvic floor. So your pelvic floor can be helping too much sometimes your back and abdominal and core muscles. And so guess what that does? That makes them so that they are a little bit too tense. And now coming full circle here, if these muscles are too tense and they are really close proximity to this bladder, they can also crosstalk to this bladder and say, hey, pelvic floor muscles are like, hey, I'm a little irritated. I'm really tense. And your bladder's like, can I help you out? And they're like, yeah, you know what? Try to alert her that there's a problem down here. And so your pelvic floor muscles can basically irritate your bladder so that it sends a message up to your brain that says, either and or both, I hurt or I have to pee. And then guess what? Those are the hallmark signs of interstitial cystitis. So with all of the functions of the pelvic floor, it's no surprise sometimes that IC symptoms and pelvic floor dysfunction symptoms go hand in hand. And in fact, a pelvic floor physical therapist can actually help you to determine what part of your IC symptoms are coming from the pelvic floor. Are they coming from your back? Are they coming from your hip? Are they coming from your deep core system? Or are they coming a little bit from your bladder? So I hope that gives you just a brief overview of how pelvic floor dysfunction and interstitial cystitis symptoms can go hand in hand. I hope that you understand now a little bit more about the functions of the pelvic floor and why some things that are seemingly unrelated to the bladder, like low back pain, tailbone pain, hip pain, weak core system, sexual dysfunction, sexual pain, those things can be sometimes the common denominator can be pelvic floor dysfunction. Pelvic floor dysfunction can cause all of those things. Pelvic floor dysfunction can cause urinary urgency frequency and interstitial cystitis symptoms. Interstitial cystitis pain can cause pelvic floor dysfunction. Hip pain, low back pain, pain from a C-section or an abdominal or gynecological surgery or a scar can also cause pelvic floor dysfunction. So we're in this big, huge triangle where the pelvic floor definitely needs to be addressed in most people with interstitial cystitis, regardless of whether or not you have a true bladder lining problem like Hunner's lesions. So what the heck do we do about this? Well, I have a little bit of a biased opinion because I am a pelvic floor physical therapist, but there are physical therapists that have specialized training in treating the pelvic floor muscles. We have gone through extensive training. We have a doctorate level education in physical therapy. We've done additional training in the pelvic floor muscles and how they work in our entire system. And we do have an internal capacity to go in and assess those muscles. And it's not like a gynecological exam. And guys, it's not like a rectal exam or a prostate exam. It's completely different. We actually can go in either through the vagina or the rectum or the anus, and we can feel each one of these pelvic floor muscles and help you to determine what symptoms of your pelvic floor are actually creating some of these IC-like symptoms. Can be hugely liberating to know at least some of what can be causing some of those symptoms. And regardless of whether or not it is the chicken or the egg, the pelvic floor has to be addressed for full resolution of interstitial cystitis symptoms. So pelvic floor physical therapists are uniquely trained to do that with you. And a lot of times people ask me on Instagram and on email, like, Nicole, how do I find a pelvic PT in my area? Well, I would honestly, the best thing to do is try to Google search and look for people that have good reviews. But here's what to look for in a good pelvic floor physical therapist. Number one, you need one-on-one time with somebody who actually is a pelvic floor specialist. Now, some clinics will have pelvic floor physical therapy, and it's either not done by a physical therapist, or it'll kind of be like a little bit of an add-on to an orthopedic clinic. And what you're really looking for in a perfect world is that there's a clinic that is dedicated people like us to these issues of the pelvic floor. And so while it doesn't have to be a standalone clinic, because there's not a ton of those that exist out there, you really do want somebody that is dedicated to a pelvic floor program at a clinic or a hospital that you are looking at. My advice and what I feel like the best practice is to make sure that we're seeing you all for 1 hour. Now, some pelvic PTs might see you for less than that, which means you might have to go more often, which is fine. But bottom line is that hour of one-on-one time with a pelvic floor physical therapist per week is super important, because I'll get to my next point. There is so much internal things that we can do with the pelvic floor muscles themselves, but there's also external things that we can do. We need to look at your abdomen. We need to look at your inner thighs, your hips, your low back, how your rib cage moves, how you breathe, how you walk, how you move, how you exercise. All of those things require both an internal and an external assessment of your entire body. We need a whole body approach to treat interstitial cystitis symptoms. We cannot just have a pelvic floor physical therapist focus only here. And we also don't want someone that doesn't know anything about the pelvic floor to try to treat externally either. Really is best when they're dovetailed together, so we can take the whole person, the whole body into approach, so we can really try to find the why. Why is your bladder symptoms, why are your bladder symptoms present? What is it about the pelvic floor in you that is creating that mismatch between the pelvic floor and the poor signaling between the pelvic floor and the bladder and the brain? What is that? And pelvic floor PTs can help you to do that. You also want a dedicated person that's passionate to help you, that really wants to walk alongside of you through this journey. As I don't have to tell you all that having interstitial cystitis is not for the faint of heart. It is tough. It sucks, quite frankly. But there is light at the end of the tunnel, and pelvic floor PTs are really wanting to help you to get pain-free, as close to that as you can, to address all of the things that can be creating your symptoms, and to also take care of all those other symptoms around your pelvis, pelvic floor, bowel, bladder, sexual health that you kind of didn't know were related. And now, after this little talk here, you know that they are. We can kill a lot of birds with one stone by going to a pelvic PT. We can be a great addition to your medical team, including your urologist or urogynecologist that's also as dedicated and as passionate about helping people with pelvic pain conditions like interstitial cystitis. And I want the best for that for all of you. Thank you so much for letting me come to this talk. Thank you for listening. I hope that you learned a little bit about the pelvic floor dysfunction, and interstitial cystitis, how they're connected, and how you might be able to add a pelvic floor physical therapist to your team to help you get on your way to as pain-free as you can possibly get. I want that for all of you guys. Thank you also so much for your support to the Interstitial Cystitis Association. This association has been near and dear to my heart. We are the only nonprofit organization that is dedicated to improving the lives of patients with interstitial cystitis or painful bladder syndrome. So continue to support this organization. We want to be here for you. And I wish you all the best on your pelvic health journey.